instead of thinking about this as some weird thing of discomfort and grossness and trying to gross out your kid, that is not my goal. My goal is that you do not leave your kid in the dark so that they start to adopt the negative connotations and perceptions that society has around periods, and then becomes another one of those people that perpetuates them either onto others or onto themselves.
Many of us grew up with one awkward talk we discussed, a book left on the bed, maybe it's a Beverly Cleary book, or total silence, so you're calling this a parenting revolution. What specifically needs to shift so puberty becomes an ongoing, developmentally appropriate dialogue instead of a one-time conversation?
If parents don't do it, as you mentioned so beautifully earlier, it's going to get done. And that opportunity and the ways in which it can get done today are so much more sinister and so much more daunting than it was before.
Hello, welcome to the show. If you are tuning in, you are watching this on our YouTube channel. And remember, if you like these conversations, you have to let me know. So hit that thumbs up sign, subscribe to the channel, because so many of you are lurking but not actually subscribing. And we need those subscribers to help the show continue to grow. And I love having the podcast on YouTube because I get to have amazing conversations. And sometimes it's nice to actually watch than listen. And so I'm excited for today's guest. She is someone that I've actually known through social media for a long time, since I've started my platform. Dr. Charis Chambers, adolescent gynecologist, author of the important new book, The Puberty and Period Parenting Revolution. It's time to own the conversation, empower your child, and rewrite the rules of parenting kids through puberty. And she's joining me to talk about social media, life as a mom, OBGYN, gynecologist, and also this book. Thank you so much for joining me today.
Thank you, Dr. Mona, for having me. I am thrilled to be talking with you.
And so, I feel like we both started our social around the same time. Remind me when you started going online for education.
Mine was July 2019.
So I was March 2019. Yeah. And at that point, we both did not have children. We both were you in training at the time, or were you already done?
I was in training. I was in fellowship.
Yeah. And what was your fellowship? I forget. In what?
It was pediatric and adolescent gynecology. Mm-hmm.
So, Dr. Chambers is an OBGYN and then went into fellowship to focus on adolescent pediatric health. So how many years total when you look at residency and training?
6 years total.
6 years.
Mm-hmm.
And what a need. Okay. Like I already want to say, like, one, I think you already know why this is such a need, but pediatric trained gynecologists are so needed as a fellow, as a pediatrician, a woman of color, Black woman. We know that there's so many things, and we're going to be talking a lot about periods and puberty, but of course there's so many things that I've seen that have been dismissed, whether it's in our Black patients, whether it's in, period health that just gets dismissed. And later on they have fertility issues. And I'm like, guys, pediatricians, we got to care about periods and we got to talk to our kids. Right. Tell me, like, what was your impetus to write this book? Like, obviously you were online educating. I know you're a very busy woman, but what made you say, we need to write this book? I need to be the one to do it.
Yeah. So I think there was always a nudging within me that I wanted to write a book. I've always been a very observational person, like since I was like a little kid. I think because I'm the third of 4 kids, you kind of have to observe when you've got older siblings, because they're going to be the ones leading the way. So I always wanted to write down my thoughts in like some sort of way that could be shared with others. But when I got into my fellowship and started meeting patients and speaking with them and definitely explaining things that I thought were so basic, like this is what a period is. And so this is why this hormonal medicine is going to help yours. I thought that made sense. But when I would do it, my patients were often saying, no one explains things like this. Why didn't they just tell us that? Why doesn't people, anyone explain it like you just did, or things like that, which actually made me say, there's something to this. Conversely, I would get in trouble in my training for spending too much time with patients because I'm like, no, she doesn't get it, but I know she can. And I constantly believed that patients deserved the education and information necessary to be able to guide their own care and partner with their doctor appropriately and collaboratively in their care, but we were often not doing it. And so I knew a book was necessary because I didn't have the time to unpack all of the things that really impacted how parents showed up for their kids during the puberty and period years. And I kept seeing the same harms. I kept seeing the same things that they thought were right. Like, it's best to just lie to them or just ignore it altogether. Like, if I just ignore it, then it'll go away. No, it won't. If I lie, then at least I can control them. They won't know about this thing called sex or whatever.
Yeah.
There were so many things that parents were doing because they wanted what was best for their kid. They wanted to protect them, but they didn't have the tools. And in the clinic, you don't have the time to give them all of the tools. And so a book was necessary. And I knew by virtue of all of the amazing interactions I'd been able to have that I was the one to write it.
What a privilege, and I'm so grateful that you're using your expertise to bring this to life. And like I said it already, like I think this book was needed.
Mm,
I would have been your agent to be like, "Hey, get this book into the world," because, we're going to talk about it, like destigmatizing periods,
mm,
destigmatizing puberty. And I just think back to my childhood, and I'm sure you can as well, to like the
yes,
lack of information I received around puberty, sex, all of these things that
everything.
we and the saying goes that if we don't teach them as the loving, connected caregiver, they're going to get that information somewhere else, and it's going to be
Yes,
shitty information. Like, let's be
absolutely.
honest.
Perfectly stated. Perfectly stated. Yes,
And
yes.
like I don't know how your childhood was, but I think your dad is an OBGYN, correct?
Yes, he is,
So
which
did you
didn't
have
help.
it didn't help. Okay, I was wondering because I grew up in a very conservative Indian
Mhm.
household when it came to taboo topics, right? Like
Yes.
alcohol, drugs, sex, all these things. Like it was never talked about. And so even
Mhm.
periods was like, okay, like, you got to do this. And it was very hush hush. And like my
Yes.
mom didn't let me use tampons and I was an
Mm,
athlete and I hated it. And
terrible.
I love that I'm a mom now to a
Mhm.
boy and a girl. And I'm like, girl, let's talk about this. I will teach you all
Yes.
about this. But we need your voice because not a lot of parents know where to start.
They don't. That is really the number one question that I get from parents. Like, where do I start?
Yeah.
When do I start? And I think that makes perfect sense because, it feels so heavy. It can feel so heavy talking about how your body's going to change and that you're just going to start bleeding. Like in the context of everything, bleeding has never been normal. So how do I normalize it when otherwise, if my baby is bleeding ever, I'm going to kiss it, I'm going to hold them, I'm going to protect them and say, I'm so sorry that happened to you. How do you flip that narrative? What does that look like? And that's why I always say it is important to have these conversations early and often and to remove all of the heaviness that we bring to it. All of the heaviness of sexualization and adultification, and even the politicalization of the
Yeah.
conversation. If we remove that, it is just as normal as talking to your kid about their teeth falling out. That doesn't feel very normal, right? But we do it. And we say, hey, I promise you, those teeth are going to come back in, and this is a normal process, and I have lived through it, and you will be okay, and I'll be with you. We need to take that same energy to period and puberties.
I love it. And a lot of parents, tell me as a general pediatrician that they're afraid of either saying too much too soon. You mentioned that
Yes.
they don't know what to say or
Mhm.
that they're going to wait too long. And,
Right.
puberty can start earlier in some children, but emotional maturity
Absolutely.
doesn't always move at that same pace. So, how should parents think about timing these conversations so they're
Right.
proactive without
Mhm.
overwhelming their child or waiting for that fifth grade, sexual education class to give them like a 1 hour primer?
Exactly. So the biggest tragedy, in my opinion, is when parents wait too late,
Mhm.
because then you're setting your kid up for this situation where they see blood and they are panicked. They
Yeah.
don't know what's happening, and many of my patients say, "I thought I was dying," because what
Mm.
else would they think? And so why would we create an environment in which there's no
Yeah.
preparation at all? And so some preparation is better than no preparation. That's one key takeaway. I have never really seen harm from discussing puberty and physiological changes too early. There's no real too early, and you know your kid, right? I also tell parents that when my son, who is 15 months, looks into the sky, because we live in Atlanta, and
Mhm.
sees a plane, I say, that's an airplane. I do not expect my baby to understand physics. I do
Yeah.
not expect him to understand why that plane is in the air or how fast it's going or what keeps it up there. No, but I do expect him to be able to look at the world around him and guide him through observation that allows him to navigate life safely and appropriately. So that's how I encourage parents to bring it up. Bring it up with what you're doing already. If you're doing toilet training and they're already noticing that they have to wipe themselves differently from their brother, that's an appropriate time to say, yeah, things are a little bit different. And that's okay. Or have you noticed that your cousin is a little bit older? Yeah, her body does look a little bit different. Or
Yeah.
maybe when you're in, those earlier third or fourth grade, have you noticed that some of your friends are wearing deodorant or even starting to wear bras? What do you think about that? Let's talk about the world around us so that we're preparing our kids to live in the world that they are already experiencing. That doesn't require expertise. It doesn't require mastery. It does require awareness and some sort of information.
I love what you just said about your son, like making it so matter of fact. And as obviously
Yeah,
as someone who has a parenting podcast, like this is an airplane. You don't need to know all the logistics. And
right.
it brought up something. So, obviously this book is talking about the puberty and the periods and all of that, but
Hmm.
how important having those conversations with boys are, right? Like
Yes.
you are, I'm sure, as being in your field, you're going to be teaching your boys about this. And the example I give is I have a 6-year-old son and he has seen me change a tampon. Okay. And
Yes.
some people
Perfect.
hearing this may be like, oh my God. And I'm like, no, like he's seen me change a tampon. I've explained that, once a month, this happens for me where I bleed out of my uterus and in from my vagina. I just use the terms. And so
Because
now
that's what it's called.
every time he knocks on the door or I'm using the bathroom, he's like, Mom, do you have blood? Can I see? And I'm like, no. But I say this because how pure. And I don't
How
have to
pure.
explain, oh, periods happen because then an egg is released and then, the uterine lining is then shedded as he
No.
gets older. But to raise a son who understands that his
Yes.
mom,
What a
his
blessing to this
sister,
world.
right, and also his peers are going to go through this is so powerful.
Yes.
So, what would you say to that family who may be listening to what I just said and is like horrified that I allow my 6-year-old son to see me change their tampon? If they're more private, if they're
Hmm.
culturally not like they've never really talked about it, what would be that first step, or what would you say to them to sort of change that narrative to normalize these conversations, whether it's with a girl or a boy?
Hmm. Yeah, so privacy, and I think privacy is something that I don't want to attack, right?
Yeah.
Privacy is important. I think it's different distinctly from secrecy. Secrecy is like, oh, I'm holding something. Privacy means I'm
Yeah.
protecting me, right? And so if you as a parent grew up in a place where your body was judged, you didn't feel comfortable showing, maybe this story, the Dr. Mona story of my son sees my tampon is not for you.
Yeah.
But making sure that you are exposing your child to the realities of life to make them a good person, friend, colleague, boss, partner, whatever. That is what's important. And so hiding the fact that over half of the population at some point is going to have a period, have a normal process, is doing them a disservice. So I'm not asking parents to be extreme. I'm not even teaching them or telling them what their values should be. I am asking them to align their actions with the goals they have for their child and how they want their child to show up as an adult. And so
I love it.
instead of thinking about this as some weird thing of discomfort and grossness and trying to gross out your kid, that is not my goal. My goal is that you do not leave your kid in the dark so that they start to adopt the negative, connotations and perceptions that society has around periods, and then becomes another one of those people that perpetuates them either onto others or onto themselves.
Speaking about those negative connotations. So, like, when I think about how many of us grew up, periods were often a punchline. So, I don't know if you remember the movie
Always.
Superbad.
Yes.
Superbad, where a
Hmm.
girl was dancing with Jonah Hill's character. Okay, he was in
Hmm.
this movie, and she's dancing with him, and she leaks through her underwear and onto his
Hmm.
pants while dancing, and it's played
Hmm.
for laughs, right? So he's like disgusted, he's gagging, and I thought,
Right.
when I was watching that, that is the culture and narrative that so many of us grew up with. That accidents
Yes.
like that are shameful. That, oh my gosh, I can't
Gross.
believe you bled. And how many of us have been in that situation where you've bled through a tampon or a pad,
Yes.
right?
All
So
of us.
I mean, all of us. And so now periods are shown as gross, embarrassing, and something to hide. And even if we don't consciously believe that, those
Hmm.
messages have stuck with me too. So, how
Yes.
does cultural messaging like that quietly shape the way parents talk about puberty? And how does that unintentional shame get passed down in our homes? And how can we fix that? Like,
Oh my
from what
goodness.
maybe a child sees, from what a parent's hearing, so we can undo this sort of stigma that you described around periods.
Yeah, so cultural conversations and the way periods and puberty are portrayed in the media play a huge
Yeah.
role in how we navigate life and what our comfort levels look like. And a huge part of my book, there's a whole chapter on unlearning, and it is calling out to parents that you have to deeply interrogate the beliefs you carry, whether you form them to survive or to fit in or whatever,
Yeah.
to make sure that those beliefs do not have some unintentional harm. And I think that interrogation process of what do I believe? What do I believe? What was I taught? Is that real? Is that what I want my child to think? what does that tell someone like me? What did that tell me at the age of 11? Those are the questions we
Yeah.
seriously have to ask. And when we start asking those questions, we can then, if we challenge ourselves, start to challenge the world around us in front of our kids. And so let's say that for whatever reason, you are watching Superbad with your preteen. Maybe you can pause it and say, now, what did you think about that scenario? Was that funny?
Yeah.
How do you think that girl felt? And so it's calling in emotional intelligence and awareness into scenarios where they didn't have that conversation. In Superbad, that wasn't their goal. But making
Right.
sure as a parent, we always introduce that and say, these are the unintentional harms of this. This is what's missing. This is why it's not good enough to just get laughs from something. Something comedic doesn't make it okay. And I hold you to a higher standard, and I hold myself to a higher standard, and we will not be this way in this life.
Mm. So beautiful. And, Charis, it seems so simple. Like, I
Mm-hmm.
love talking to you because, of course, like I said, I'm a parenting obsessed person. Like, I love talking
Yes,
parenting. I love talking about, and
you're
to
so
me,
good.
all of this seems so obvious, right? Like, you're like, just, you don't have to have all the perfect scripts. All you have
Right.
to do is show compassion and willingness to rewrite what you've already known because you want to improve for your child. Like,
Mm-hmm.
I
Mm-hmm.
know that I don't want my daughter to feel how I felt being shamed, not being able to use a
Ever.
tampon, all the things, right? And
Mm-hmm.
also, I don't want my son to be raised like a lot of my peers that are men,
Yes.
Indian men that I knew growing up that were so stigmatized, like had
Oh
so
my
much
goodness.
stigma around
Yes.
periods. And I'm actually teaching my husband how to undo some of that too, because
Which
he's
is
like, why are you
important.
showing your son? Why are you showing Ryan? Like, I'm like, because Ryan needs to know that this is something that happens. I'm not
Mm-hmm.
forcing him to see it. I'm not
No.
dragging him into the bathroom against his
Right.
will. Come in here and look at my tampon. It's curiosity.
Right.
And you have, like, with parenting, it's about taking the curiosity, running with it, trying to say the best you know what
Right.
to say without worrying so much about, did I just do that right?
Yes, that's perfect.
Because
Yes,
you can always
run with the
repair. You can
curiosity.
always,
You
yeah.
can always, and that's why the early and often thing is you have
Yeah.
more time for repair, recalibration if you start early. And that's the part that I want parents to not be so afraid about. This is not striking while the iron is hot. It's not one
Yeah.
of those things. You have continual fellowship and communication with your child. Use it. And as you grow, let them grow too. This is
Mm.
dynamic. There is no end point. It is not like some
Yes.
finish line where it's like, okay, you have to show up. No, this is a continual process, but do not leave your child behind during this process.
And I love the title of your book. I know going all the work that goes into getting a title for a book. We chatted about that because I'm in the process of writing my book, and I'm sure the title may change 100 times before it actually
Yes.
debuts. But I love the term that you talked about, parenting revolution, a period parenting
Yes.
revolution.
Mm-hmm.
Many of us grew up with one awkward talk we discussed, a book left on the bed, like maybe it's
Mm-hmm.
a Beverly Cleary book, or total silence, so you're calling this a
Yes.
parenting revolution. What specifically needs to shift so puberty becomes an ongoing, developmentally appropriate dialogue instead of a one-time conversation?
Yeah, so I think we got those one time conversations, if at all, because we grew up in a time in which there wasn't as much access to information, right? There
Yeah.
wasn't as much right in your face. And certainly there was a kind of an understanding that your school was going to at least touch on it, right? Times have changed.
Yeah.
They have changed drastically. And the political climate that we are in is one that is showing and trending towards efforts that limit that discussion more and more and push it later and later. And so that's going to negatively affect those folks that get their periods early, that start puberty earlier, that look like us, that are brown and black girls who tend to start before their white counterparts. And so what we're seeing is a shift that is going to disproportionately affect a certain group of people, which is already a problem. But we also are seeing that if parents don't do it, as you mentioned so beautifully earlier, it's going to get done. And that opportunity and the ways in which it can get done today are so so much more sinister and
Yeah.
so much more daunting than it was before. With our access to smartphones, folks getting their kids smartphones by the age of like 10 or 11. That means that they have access to this entire world. Um, and so the revolution aspect is a suggestion that we need to have an intentional effort to reclaim this conversation, to reclaim the influence that parents have, as the primary caregivers, as those who know our children better than anyone else, as those who love our kids and want to protect them more than anyone on this planet, to be the ones to guide this conversation and not leave it up to chance. That's why it needs to be revolutionary, because it's that serious.
And I love that you are putting this in the control of the parent because in the end, that's what I think every parent wants, but they don't know how to do.
Yes.
And
Hmm.
you said it beautifully. I don't want a school teaching my kid about this stuff. I appreciate the schools for what they do, but
Of
when it
course.
comes to very personal things like body image,
Yes.
sex, things like that, I want to be able to teach them. But like to
Yes.
your point, a lot of us and maybe a lot of our listeners, would hope my listeners are not like this, but would need to kind of undo a lot of the stigma they carry around these things, right? Because in
Absolutely.
order for us to
Absolutely.
actually teach them in a way that they need, we have to say, you know what? That didn't serve me well. I did not like that. And I want
I
to do different by my kid.
I want to do different. And I want to just kind of interject and say, it is not that I don't want schools to try, but the responsibility is mine. Just like the responsibility that my kid is literate and functional is mine.
Yes.
Yes, I'm sending them to school, but if he doesn't do his homework or doesn't learn to read, that is on me. And so it is a collaborative approach, but I'm the one who can form it with my values and with what I know specific to my child in this custom made, love bathed approach that the school is not necessarily able to do and isn't funded to do and isn't really meant to do. And so I don't want schools to stop necessarily, but I want
Right.
parents to tap in.
Yeah, and I mean that goes for so many different areas. Like you said, you brought up reading beautifully. You talked about all like, bullying, being the bully, being bullied, like all of those
Yes.
conversations are being carried home and it starts with parents being comfortable with having the difficult conversations. And for all of you
Yes.
listening, remember what we're both saying, you don't have to be an expert at knowing what to say.
No.
And like that leads me to my next question, which I'm
Hmm.
I'm curious how you've approached this maybe in your office, but parents have often asked me like how do I explain anatomy? You
Yes.
alluded to like how bodies can look different. Maybe a girl is going through
Hmm.
puberty a little earlier than a peer. How do you explain anatomy without turning it into a full biology lecture? And maybe
Hmm.
how have you done that in the office, or have you had to do that?
Oh my gosh. It is my favorite thing.
I
I
love it.
explain anatomy at every new patient visit. I actually have a little uterus that's not dissimilar to this. And you will see in my life, I have so many uteri like around me and vulva. My husband's just like, what do I do with it? Because if people don't see it, you
Yeah.
cannot expect them to understand it. And
Yeah.
even in my book, I have diagrams for this very reason because I want parents to be able to see it. And if you type in uterus, on Google, you can get all sorts of things. So I want to, especially don't even start on vulva. So you want to make sure you're giving them something that is not too advanced, that's easy to actually see. And so I like very simple diagrams that are labeled,
Hmm.
but I hold one in my hand and say, these are our reproductive structures. This is a uterus. It looks like an upside down light bulb. Isn't that kind of
Yeah.
silly? Right? And at the bottom of it is the cervix. That's the door to the uterus. That's what dilates to 10 centimeters when a baby's about to be delivered vaginally. And they're like, she's 10. They're like, yeah, I do know that. Okay.
Yeah.
Now, and then that connects to the vagina. Fun fact, the vagina's on the inside entirely. When you're talking about the outside, that's the vulva. I'm like, okay.
Yeah.
And I say, okay, on both sides of the uterus, we've got fallopian tubes. They look like little pigtails, but they're actually tubes. And their whole job is to pick up eggs from the ovaries, these little oval shaped structures on both sides. That is what's inside your body. And that is what's changing when you have a period. That is literally my exact talk track that I present in my clinic. And the parents are like, wow. And the kids like, okay. Like it makes so much more sense to give
Yeah.
them an actual life-size version that says this is what's happening. And when you have pain, the lining of the uterus is releasing inflammatory markers and it's causing cramping. And I'm so sorry, but that's why we're going to try some anti-inflammatories. Doesn't that make sense? They're like, well, yes. So now you've got the kid on board. You haven't assumed any level of health literacy from the parent, and the parent is very likely learning at the same time. So I think anatomy can be taught, but it doesn't have to be crazy. I say uterus, cervix, vagina, tubes, ovaries. That's it, because they are critical to the process. We don't have to get into, ligaments and blood
Yeah.
supply and
Yeah.
no, that's crazy. But I
Yeah.
do think understanding those specific structures is key to understanding your body. And if someone is bleeding, they need to understand those structures.
I love it. And again, we have to normalize saying the words,
Yes.
we don't need pet names for the
Oh
vulva,
my
for the
gosh.
vagina. And the thing I use is that if we're not making pet names for ears and nose, why are we making pet
Right.
names for our genitals,
Yes,
right?
it
And
is
I mean, there's so much
teaching.
stigma, right?
It is teaching. It is perpetuating stigma. just by doing that, just by saying, instead of saying nose, because you don't say your smeller, like, no, you
Yeah,
just say your
exactly.
nose. Like, why would you do that? That is so weird, right? And so the ways in which we perpetuate stigma are not glaring. They're not even always negative, but they're still perpetuating stigma.
Yeah. And I mean, we're talking about obviously periods and reclaiming puberty and all of that, but this conversation always can go into safety in the future, right? All of y'all have known that I've
Always.
had conversations before about why we need to teach our children anatomical names. I'm going to give a shout out to one of my fellow pediatricians, Dr.
Mhm.
Krupa Playforth. She wrote a book about boundaries and about body
Nice.
parts.
Yes.
And
Hmm.
in the book, it's meant for kids. It has images of a penis, like obviously
Nice.
animated, and
Hmm.
images of a vulva, vagina, and how some
Perfect.
boys are circumcised, some boys are not. And I
Hmm.
think it's fabulous. And then I read the reviews because I was going to leave a review because I'm a good friend and I love her. And some of them were like, it's not appropriate for children. And I changed my review to be like, this book from a fellow pediatrician is what kids need. It's not too early to talk about
Right.
what genitals look like because they have them.
Because
Like,
they have them. Like, they literally have. Yes.
and so I have to message her. I don't even know. I haven't even messaged her that I did that. But I was like, so I was actually like really upset that people wrote that review. And I'm like,
Right.
absolutely not. Like you're the one who probably needs this book for your
Right.
child
But
because they need to learn it from you.
yeah, do you know what my favorite question to ask in those scenarios when they say this is inappropriate? And I would say, why? Why
Yeah.
is it inappropriate? And then they might say something like, well, they shouldn't be looking at something like that. Like, well, do you think they don't look at their own body? So, well, it's
Hmm.
fine for them to look at their own body. Well, is this teaching them about their own body? Does that help?
Yeah.
Like,
Yeah.
I always ask questions because as I ask questions, the curiosity that comes with that, it tends to get to the core of it. And it's almost always this odd adultification bias that's being applied to a child who has no context on that, or sexualization that is not a part of the context of the child either. It is something that we as adults are bringing into this conversation and thereby ruining it and tainting it with our own wounds and with our own traumas and with our own stigma that we haven't worked through. That's why that is so important to start with.
Ugh, I agree. And, you talked already about, you mentioned like a story that some of your patients had said to you, like, I thought I was dying when the
Mhm.
period started. Are there any other, like, I mean, I get it. We can say it in our head, we're like, oh my gosh, poor girl. But like, if they've
Right.
never heard of that or seen that, obviously it's going to be terrifying. Are there any other examples of like conversations that you've had that you were like, "Oh my gosh, this is
I have
why I
conversations
need
for
to
a
write
day.
this book?"
Yes.
Because people
So
or teenagers had whether it's about hormones or periods or something that you're like, "Oh no, honey, like we need to talk about this."
so many things. So,
Yeah.
one in my book, I do start each chapter with like kind of like a composite clinical
Mm,
anecdote that comes with years of experience, and no one patient obviously is represented in each anecdote, but it gives these real life examples, so it does feel more tangible and real, which I think is good.
yeah.
So, for example, I was talking on Instagram and asking folks about experiences of getting their first periods with their dads were around, their moms weren't, and
Mm.
one of my followers said that her dad told her to put her legs up in the air until her mother came home.
Oh my
And she
god.
was like, well, it didn't help. I
Poor
was like, well, of
kid.
course not. And she was traumatized, but he had no
Oh.
idea.
Yeah.
Um, Gosh, I had another story. This was when I was doing a documentary, and the mom was sharing her first period story, and she said that she hid it from her mom for a year because her mom had told her that when she got her period, everything was going to change, like all this stuff. And so,
Oh.
because she didn't want life to change and her relationship with her mom to change, she hid it. And when her mom found out their relationship did change, she said that her mom stopped calling her like pet name for her. It was
Mm.
like things shifted at the drop of a hat. And that is why one of my pet peeves when it comes to period discussions is the misconception that you are now a woman. Oh,
Yeah.
that kills me. And
Yeah.
I get from a cultural standpoint some of the distinctions culturally that apply to that, but the narrative, the word choice that you have ceased to become my child, to be my child, or to be a girl, and you are now thrusted into womanhood
Wow.
because your body decided to bleed is one of the most harmful narratives that we don't even recognize. And so a lot of the stories I hear, some of them are kind of comical and just like, oh my goodness, like the legs up in the air one. Some of them are just like, you poor dear, like I thought I was dying. And then there's some that like tug at your heartstrings. Like, I didn't want to tell my mother because I knew she would change. Like, what
Ooh.
does that
And
mean?
do you feel like that's important that we don't do that? Because it, again, we talked earlier about that emotional maturity doesn't excel as fast as the
Right.
physical maturity, that they're just not ready to be a woman and they don't know what that
Mhm.
means, that can be scary for them?
Terrifying. It can
Yeah.
be terrifying. And it can even promote this like almost association from your body. Like, my body is changing, but I am not attached to it. And so I don't
Yeah.
connect with this changing body. And so much so, because of how people are responding to this body, I'm further detaching myself,
And
because
that's
that's
so
what the
hard.
brain must do. And it is so hard. And these processes that happen so early impact how folks navigate their entire reproductive health life journey, like into childbearing, into intimacy, into
Yeah.
perimenopause and menopause. This detachment from my body never does what I want it to do. We are adversarial in nature. Our relationship is at odds. That's horrible.
And I just love that you mentioned that this isn't just about puberty, right? This is
No.
about the future of a woman. Like, and
Right.
you mentioned the word intimacy. You mentioned the word, obviously, like childbearing. This is
Hmm.
why this matters. Like, I actually think a lot about intimacy, and my husband and I have chatted a lot about it, and how the
Hmm.
lack of discussion about all of these things is a lot of the
Yes.
reason why people are having really bad sex. Like,
Really bad sex. I'm like, this can
like
make life better in so many ways if we
because
did.
you're not in
Yes.
tune, right? Like, and you
You're
just said it,
not
like,
in.
if you're shaming a little girl, not teaching them to be
Right.
in tune with their body, how are they going to advocate for what they want in intimacy?
How? And that's another point I highlight to my teen parents, especially when they're
Yeah.
like, well, she doesn't need to know all that. You are saying that your daughter's knowledge about their body, her body literacy is contingent on whether she is partnered in a relationship that you approve of. So that her understanding her body is only for the pleasure and enjoyment of
Yes.
someone else, not
Oh,
for protection, not for safety, not for herself, but for someone else. And you think that makes sense?
yeah. It does not, as we
It
both
doesn't.
know.
Right, right. It doesn't make sense. So
Oh,
so that kills me too,
yeah.
because and it makes my job hard as a pediatric and adolescent gynecologist, because there's stigma that the only reason you'd be taking your child to see a doctor like me is because they must be doing something they shouldn't be doing. They must be promiscuous. It must be about sexual activity or birth control. No, as you so eloquently stated, they have the parts. And anytime you have the parts, issues can occur. Just like a baby can have, issues from a cardiac standpoint. It doesn't mean that they had they were a smoker their whole life, or they
Right,
didn't,
right.
something that caused this. This is oftentimes something they were born with, or things that happened. Anytime you possess the parts, you can have issues with those parts. And so seeing a doctor like myself does not mean that there was some behavioral issue that promoted, the need for my care ever. And I hate that stigma.
And I believe that you talk about birth control in the book, right?
I sure do.
Yeah, and so,
I
and
do.
I'm happy because there's obviously a lot of noise online about hormones, periods, and even birth control. And
Yes.
you've already mentioned this term. There's a lot of political, things happening to try to remove access for birth
Yeah.
control. And obviously, we want to allow the education to shine through and support of the girl. Why was that important for you to include? And how can families sort of introduce this topic in a way that sort of aligns with their values, but also, supports the child,
Mhm.
obviously for what's happening.
Yeah, so I mean, because I am a provider that uses birth control, and I call it hormonal therapy largely, unless we're
Yes,
actually
smart.
trying to prevent pregnancy, because that's like calling, Tylenol, an antipyretic or whatever. It's like, well,
Yeah,
actually, it depends on what you're using it for. Some people use it to treat a fever, some people use it to treat a headache. But if I take it for my headache, it doesn't mean I have a fever. The same way, if
yeah.
I'm using hormonal therapy to treat someone's very severe period pain, it doesn't mean that they're necessarily sexually active. And so part of it is the recasting of birth control as medicine,
Yeah.
as hormonal therapy, as medicine that is a part of the tool belt that is necessary to appropriately treat your daughter or treat your child or anyone who has period related issues that respond very appropriately based on physiology and pathophysiology to hormones. And so when people are like, well, why do you have to use hormones? Well, why do you have to use insulin for diabetes? Because
Right.
that's how your body works. I can't circumvent your body. Your body told me that hormones are the pathway that trigger what your period does. It dictates how long it lasts, when it starts, and all of those things. And so that's what we're going to use to make this better. And so it's a reframing of that conversation and showing a ton of legitimate reasons why we use birth control in younger populations, like menstrual suppression in my patients that have cognitive delay or any type of meaningful mental or physical
Yeah.
impairment, or helping to manage seizures in patients with epilepsy that have catamenial seizures that are worsened by their periods. Like there's so many things that affect your periods and that your periods affect, and that hormones and hormonal therapy are useful for. So casting it as birth control that can only be used by some precocious teenager that is doing stuff they shouldn't be doing misses a major opportunity to show up for your child appropriately. And that's why it had to be in this book.
And, I think we talked about, I think a lot of parents think that by having the conversation is encouraging the behavior, which is furthest
Oh
from the
my
truth.
gosh. Because
Like,
if that were the case, then we could talk about being a Rhodes Scholar and our kids would be one,
yeah,
right? Like we don't have that
exactly.
influence. So sorry.
And like again, when we talked, I mean, the common thread here is that if you're not talking about it, they're going to learn about it from a
Absolutely.
bad account on social media or
Hmm.
a partner that isn't knowledgeable, right? Like, I mean,
Right.
there's a lot of people that don't know, like we've talked about, and can actually manipulate and hurt that person. You are in control as the
Yes.
parent, everybody. Yeah.
Exactly. Exactly. And when you withhold these things, your kid starts to say, my parent didn't tell me something. I can't
Mm,
trust them fully. Or when you tell them untruths or lie to them, they start to find out because we have access to a ton of information. Like, wow, they're not a credible source. I've got to look elsewhere. So do not sabotage your credibility by lying or misrepresenting the truth. Tell them to the best of your ability what you have so that they trust you and continue to come to you when they do have questions.
this is music to my ears. I have a pod. I'm like doing like a heart sign for anyone who's not watching. But one of my favorite solo podcast episodes I've done is talking about the three things that every kid needs, and it's safety, trust, and connection. And this is part of
Yes,
the safety and trust component, right? Safety in
absolutely.
being able to ask questions, trust to knowing that your caregiver is going to do what they say and follow through, and
Yes,
this is part of this,
yes.
example. I'm curious, I'm so glad that you included the hormonal therapy, and thank you so much for that
Yes.
reframe. I love that
Hmm.
terminology. Hormonal therapy versus birth control is exactly how we should be describing it.
Yes.
What are some misconceptions you've heard in your practice, or maybe do you address in your book? What I've kind of read online is a lot of people afraid of hormonal therapy, aka birth control, for anyone
Hmm.
who's not familiar, and that it can cause fertility issues down the line, which me and
That's
you both know is not true.
Yes.
But what have you said to
That is
those
the
families?
number one, that's the
Yeah,
number one concern that's brought up. And so I love addressing it. I do like to make sure that I hold space for the historically valid distrust that certain populations have of the medical system as it relates to fertility,
mm,
right? There is a history in this country of misrepresentation of what medicine was or what surgery was, where fertility was stolen or negatively impacted, and that wasn't shared. And so instead of acting like I'm oblivious to it, I acknowledge it. I say, you know what? I'm fully
yeah.
aware that this medical system has done some things where birth control is presented with crazy side effects and all of these things, or procedures, were done where a hysterectomy was performed and that wasn't disclosed. I get that. And I fully understand why it is so important to you to protect fertility. As a matter of fact, that's why I'm talking to you about this medicine, because I'm worried your daughter has endometriosis, and that
Yeah.
actually does impact future fertility. And this medicine can prevent its progression, thereby actually protecting her fertility. Or I'm worried that this is actually going to worsen things or things of that nature. So, what is real? What is imagined? And how can I validate all of that so that you make a decision that feels good for you? I am not paid by birth control companies. I didn't invent it.
Yeah.
That doesn't serve me. What serves me is that you use all of the tools that you can to support your child. I also cite studies. It's my favorite to say, hey, there was actually a study done that looked at birth control users and those who never used birth control and looked at how long it took them to conceive in a year. And 80% were pregnant within both groups, which shows that there isn't
Yeah.
continued fertility issues. Also, I used birth control when I was freezing my eggs because my fertility doctors, whose whole job was to allow me to get pregnant, to actually freeze these eggs, knew that birth control would not harm that possibility. But talk to me about whatever you've experienced or who you've talked to where you feel like this is a more legitimate concern. And they might say, well, my sister, she had PCOS and she started birth control early. And then when it was time for her to get pregnant, she got off of those pills and she still had issues. I'm like, well, yes, because she had PCOS.
Yeah.
And this is not a cure, much like, and I always talk about other medicines. I take blood pressure medicine. If I stop taking it, don't you know my blood pressure is going to go up? It sure is, because it was never meant to be a cure in the first place. So my blood pressure medicine doesn't cause hypertension. It was managing it. And when I took it away, it came back because I stopped the management tool. And so reframing and actually validating these concerns instead of saying that's absurd. That is how you grow trust. And that's how you can, guide people to make the decision that's actually informed by facts instead of fear.
You know what I love about you? Do you know that I love you? I don't know if I can say that, but you know what I love
Oh,
is
I
that
love you.
to meet other creators, doctors
Hmm.
who, and I find this to be true of a lot of people who go online because we don't go
Yes.
online if we're not like this, but to hold such compassion for the patient and good education. Like that's what I just heard from what you just said, right?
Mm. Oh,
You
thank
held
you.
that hand of that parent. You were like, hey, I understand where you're coming from. I want to explain to you what I'm doing for your child
Right.
and why it's not what's going to happen, right? Like we've lost so much of that in healthcare. And I
Mm.
think you would agree to that just because of insurance companies, reimbursement, time with our patients. But
Everything.
kudos to you for doing that, striving to do that, but also creating a book that can continue to do that for
Yes.
generations to come. I just love it.
No, and I think one, thank you for that. But the problem and the reason people turn to social media and turn to so many other sources outside of professionals like ourselves is because those conversations don't happen enough. They are made to feel silly or paranoid or um, I don't know, illogical when they have real concerns. No, you're a
Yeah.
parent. My God, I would never want you to give your child something that you thought could harm their fertility. And until you feel good about it, I don't want you to give it to them. I don't want you to agree to my plan if I haven't made you feel good about this plan. And so I always say, until you feel good, I don't feel good. It is
Yeah.
not a check mark for me. I want you to be on board and to feel fully on board. And that's what true informed consent is.
And that is the revolution. I feel
That is
that's
the
what you're doing
revolution.
here. I love it. I mean, for the parent listening who feels behind or anxious about getting it right. I know we've discussed
Mhm.
different strategies, but what would be the first place you tell them to start today after listening to
So,
this, getting your book? Yeah.
so really good parents do not worry about being behind. They're not anxious about how they show up. Only good, I'm sorry, bad parents. Only good parents worry about being anxious or worry about being behind.
Yeah.
That speaks to an inherent desire to do what is best for your child. So just that nudging in your spirit shows that your heart is in the right place. You are on the right track and your desires are aligned. Start small. Start with you. Start with unpacking. What did I learn? What did I not learn? What do I still have questions about? What do I feel so uncertain about that it might draw me to tears? What is a
Yeah.
sensitive point? What do I need to work through? Maybe even through therapy, maybe through meditation, maybe through all sorts of different processes to make sure that you heal the inner child in you so that you can show up for your child. A lot of us show up for our kids with just the scraps we have because life takes so much from us.
Yeah.
But if we can show up in our best selves, that is how we positively impact our kids. So instead of feeling anxious about being too late, today is always the best day to start. It is always better than tomorrow. And if you continue to show up over and over again, you have time to repair, to recalibrate, and to restore. So don't be afraid. Don't be afraid because you will definitely be better at educating your child than this world, than the internet, than whatever else is the alternative. So,
Here, here. I mean, you can write my parenting book with me because that is it. That is it. I mean, I'm just
yes.
so in love with that. And again, it just applies to so many different aspects beyond what we're talking about. And again, I think that's this discussion about period puberty revolution. The revolution that
Mhm.
I see in you is that you're changing the sort of narrative on how we discuss difficult things with our kids. They don't
Yes,
have to be difficult.
they
What does
don't.
success actually look like for people reading your book? Like in, let's say in 5 years, your book is on the market, people are grabbing it. What do you hope that they feel after
Oh,
starting that book and finishing it and closing the back cover?
yeah. So, above all, I hope that they feel safe
Mm,
and seen. I hope that my book doesn't make anyone feel excluded or
yeah.
incapable or inconvenient. That is so, so important to me to always speak to like the margins, because I feel like if we speak to those who are marginalized, we include the folks in the middle.
Yeah.
I want the people that have been forgotten in these conversations, the ones who felt like they were not sure or not the right fit, to feel like they are the right fit, to feel empowered to show up. I want there to be more conversation around puberty and periods. I want parents to be healed. I want them to say, you know what? I read this book to show up for my kid, but now I show up better for myself. I show up at my doctor's office with more information. I now can model to them what a good doctor-patient relationship looks like. I want it to be a book that people share and give to anyone who knows anyone who influences, impacts, or guides someone with a period. This is not just for parents. This can be for grandparents, for aunts, for uncles, cousins, coaches, school nurses. It can be for anyone who wants to see a better tomorrow. And I genuinely believe that reproductive liberation is how we make tomorrow better for this generation and for generations to come.
I love it. Thank you so much. I Again, I'm just motivated. I have already been doing this work, but I'm just excited to read this book just so that I can continue to do the work with your
Yes.
voice with me. Like obviously with your expertise, I know I'm going to learn something.
Oh,
I know that because that's the thing about fellow creators and fellow people who are
you
in their
learn
niche
so
and in their
much.
specialty. So thank you for doing this. I can't wait for so many people to read the book. Where can people go to stay connected with all the work that you're doing and also get the book?
Yeah, so you can follow me, of course, on Instagram at the Period Doctor, also on TikTok at the Period Doctor, and then my website is theperiod.doctor.com. On my website, you can click and actually subscribe to my newsletter where you will get updates about my book. You can order the book, pre-order it now, actually, on Amazon, Barnes and Noble, all sorts of stores wherever they sell books. If you type in the Period and Puberty Parenting Revolution, you will be able to find my book.
And everybody, if you love this conversation, which I would be shocked if you didn't, please make sure you hit that thumbs up sign, subscribe to the channel, ask any questions you have in the comment section, because
Yes,
maybe Dr. Chambers can come back on my show. And if
I'd
you
love
do
that.
also love this conversation, grab the book. And I had alluded to this, leave a positive review, wherever you can leave
Please.
reviews for the books. That really helps authors. And I would love to support, this book as it reaches so many more people. Thank you so much for joining me.
Of
I'm so
course.
glad we finally got to connect.
Likewise, you are lovely. I learned so much from you, and I'd be happy to return to chat again.
Likewise, everyone, thanks for joining me. Again, subscribe, hit that thumbs up sign, and I cannot wait to have another amazing guest on the show next time.